Hello, so I thought I would do a video answering a lot of questions I received from you guys, and I thought instead of me responding to everyone individually in the DMs and emails, I would just do a video to make it easier and make it more personal. So I've got a lot of questions, so I will be doing two videos answering them just because I reckon it will take me a really long time and you guys probably don't have the attention span to listen for that long. Okay, so first question, what did you like about the course? So a bit of background about myself. I got into the PA program because one day I was feeling really unwell and I went to the GP and there was a girl sat in the GP waiting room next to me by chance, and she just kept looking at me and I was just like, okay, it's a bit weird. And then eventually she was just like, how old are you? What do you do? What did you study? Blah, 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 blah. And I was just like, I studied pharmacology and at the moment I'm working in a bank. And she was just like, oh, you studied pharmacology? Me too. And then I was like, okay, that's like great. And then she was just like, so am I allowed to come into your consultation with you? And I was just like, I beg your pardon. And she was just like, oh, I'm so sorry, I'm like a PA student. And I was just like, okay, that doesn't mean anything to me. And so she explained a little bit about the role and the course, and she was just really encouraging and telling me to sign up for it and apply. She was actually a St. George's student as well. I never actually got to meet her again. Although I did ask some of the friends I had in a year above me whether they knew who she was. I didn't know her name or anything, so I never really got to thank her for changing my life, essentially. But what I liked about the course, okay, that was just a bit of background, I'm so sorry. But it kind of gives a bit of background. I had no idea what I was getting myself into. I didn't even really know what a PA was up until I started working in GP. And going back to the question, what I liked about my course was that we got straight into placements within the first few weeks of starting university. We went straight into primary care, which is GP, once a week. We had timesheets that we had to log our times on, and I reckon ours was either 4 or 6 hours every Wednesday. And I really enjoyed that because it really enabled me to solidify the knowledge I had gained and really put it into practice. And also it made me more aware of things that we hadn't learnt yet. So it was a really good way of building a foundation of knowledge, sometimes even before you've studied it or been taught about it. What else did I like about the course? I really enjoyed, to be honest, the aspect of learning about medicine and diseases and illnesses and everything. I've always found that quite interesting, and the fact that I have so much knowledge now and I can actually give people advice and help them is something that gives me a lot of satisfaction. So I would guess it's kind of a passion of mine, although I was never, well, there's some questions about this a little bit later, but I was never interested in working in the medical field. I never ever wanted to be a doctor. So yeah, so the next question is, why not medicine? So like I said, I've never been interested in becoming a doctor. It doesn't appeal to me in the slightest, which is really funny because we're sort of trained to the medical model and we're kind of like similar. Well, we are very similar. Our jobs are quite similar. We have the same goal in what we do. But the training of becoming a doctor, so studying for 5 years of medicine, that part of it I don't mind. I could have studied the PA course, you know, we did everything in 1 year. So spreading that out in 5 years and learning a bit more isn't something that doesn't appeal to me. That actually sounds maybe even more enjoyable because I've got more time to really learn everything. and be 100% confident. But after that, after you study medicine for 5 years, it doesn't just end there. So I wasn't really aware of the path that doctors need to take in order to become, so they graduate, then they're junior doctors for a minimum of 2 years. So it's called FY1 and then FY2. Then they have to do exams and choose like what speciality they want to go into. So they have more exams. Then they become a registrar for, sometimes it depends on the speciality. There's so many different routes that they can go down. But for example, some specialities can be 3-4 years, sometimes more. And it will take longer if you take any breaks. So as a woman, if you become pregnant, obviously you'd have to take some sort of maternity leave, so that will postpone your training. And then there's even more training after that. There's even harder exams after that, and up until you become a consultant. So it's sort of non-stop, and that just doesn't appeal to me. And the working hours are completely different. As a PA, you sort of work full time. Depending on where you work, your hours will be very different. So I've actually worked full time, which is 35 hours a week as a PA. And there's also jobs going for sort of like A&E roles, hospital roles, which are 3 days of 12-hour shifts a week, which also equivalates to sort of a full-time job. And the salaries can vary depending on where you work. But my main point is that the ethic of a junior doctor, I personally think that they are worked a lot harder, and they have to work in loads of different specialities as a junior doctor. So during their first 2 years, they have to do different rotations in different specialities. Whereas as a PA, once you graduate, you're in control. You can choose where you want to work, for how long you want to work there for. So I always knew that I wanted to work in GP. That was my end goal. So I'm able to just go straight into it, basically. So yeah, the work ethic, the job itself is different. Obviously, the benefits and advantages of being a doctor are a lot compared to being a PA. PAs are a little bit more restricted in what they can and can't do. Even simple things like writing prescriptions, although that may change in the upcoming future. So the next question is, can you apply for jobs before you sit your nationals or get your national results? So yes, you can, and I would highly suggest that you do. Worst case scenario, you don't pass your nationals and you postpone your job, or a lot of jobs actually, what I've noticed amongst my peers is that they will start you on the job even before you get your national results, because there's so much to do before you start a job anyway. There's a lot of training. You need to be trained on the system that the GP uses or the hospital uses. There's lots of like paperwork to be done. So even if you don't pass your first attempt of your nationals, you have to wait a couple months. But in the meantime, you can work as a HCA in the practice or in the hospital. And it will really help gain your confidence for when you do start working as a qualified physician associate. So I would recommend you do apply before getting your results. How did you revise for your university exams and nationals? So a lot of people, personally, the way I revised is, I'm not gonna simplify it. I had the matrix in front of me and I went through every single condition on the matrix. I made notes. So if I just show you the book I'm reading from, so just like a normal book like that. I'm actually wondering where my notebook is. So I've actually lended one of my friends my revision book and I just haven't gotten it back from her. But I literally have 4 of these filled with the matrix, and the areas that I wasn't really sure about, I would rewrite them again. So I would go through cardiovascular, I'd write hypertension, signs, symptoms management, and I would just go straight through the whole matrix. I know it's really long and it's probably not the most ideal way of revising for a lot of people, but for me, that's the only way my brain really worked. And then I would do a lot of past test questions on websites. But what I did find really annoying, which I am really excited to, I don't know if I really want to share this with you guys, but I'm going to, just so that you guys stay updated, is in the upcoming future I will be creating a revision website specifically for PAs, because I found that when I was doing questions for medical students, a lot of it was really advanced and a lot of it was content that I didn't really cover in PA school. So I got quite frustrated and quite demotivated when I would get a lot of questions wrong. I'm not going to name names of different companies, but it's actually one of the questions, so we'll probably touch up on it later. But there were certain websites that, as I would answer the questions, it would just be red, 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 green, red, red, red. And I just didn't find that helpful to my ego and my pride. It just made me feel like I wasn't doing enough, and I would beat myself up about it. But then I realised that this was really common. All my friends were experiencing the same thing. And a lot of you guys have been experiencing the same thing. So I really want to build a website and bring you guys content that you should know and that you can really test your knowledge, because it's tailored for the physician associates in the UK. So that's how I would revise. I would revise all the conditions and then do questions. So the next question is, what percentage of past med questions would you get wrong? Because I am feeling really down by all the wrong answers I'm getting. So I basically answered the question in the previous answer. Don't get dulled down, because we didn't study for 5 years and the amount of content they have covered is nowhere near the amount of content we've covered. You know, logically they would know a lot more than us, and we're not doctors and we're not medics. So unless you're doing a past test question paper on physician associates, then don't be alarmed. And stay tuned for the upcoming future. Please make sure you join my website. I will definitely let you guys know once it's ready and it's live. It is still work in progress, so persevere. It will come hopefully before summer. So I'm a final year biomedical student and I want to do the PA program. Do you have any advice? Okay, and this ties in with the next question, which is, what work experience do you recommend? So for a final year biomed student, I didn't study biomed, I studied pharmacology, but essentially everything you learn in biomed that you think is relative and related to clinical work, make sure you keep your notes, because it can come in handy and it will help you understand more conditions and revise better. During undergrad, what I would say is what would be really helpful is if you conquer your style of revision and transfer it into the PA program. In terms of work experience, honestly, when I applied for the PA program, I didn't have much work experience. But I'll be very honest with you guys, I've read over 50 personal statements. I have marked over 50 personal statements. And people have become very sophisticated. A lot of applicants have really done the most. So honestly, the best thing you can do in your summer holidays, because you guys have a long time, and especially right now that everyone's in isolation, I know hospitals are really busy right now, so they probably won't respond to your emails. But if you make a list of hospitals near you, make a list of GPs near you, once all this kerfuffle of Corona has died down a little bit, contact them, send them emails, see if they're open to having you shadow for a few days. Even one day of shadowing in any speciality, any healthcare setting, even if it's a dentistry, it will show you a lot. So I personally did do work experience in a maxillofacial dentist practice, and I learned a lot. I learned a lot about patient confidentiality, patient safety, teamwork, communicational skills between teammates, because obviously all dental doctors obviously have a dental nurse. So the communication between them is so important, especially when they're doing minor surgeries, such as extractions, things like that. So witnessing their communication skills and also witnessing the communication skills that they've built with their patients, that rapport that they've built. And dental practices are really easy to get work experience in. So those are things you can gain from that. Elderly care homes, you can gain, honestly, they say the opportunities are endless, and it's true. Patient safety. So most of the people in the elderly care home I spent a few days in, a lot of them had dementia, Alzheimer's, Parkinson's, urinary retention, which means that they can't go to the toilet naturally. And you learn so much by just being in those environments. So you learn how to be compassionate, empathetic, again, patient safety, learning how to abide by regulations and rules. And these are so important, and they're so good to be put on your personal statements. Should anyone have any issues or any questions, obviously email me at aphysicianassociate@gmail.com, or at me on Instagram, which is aphysicianassociate. Send me your personal statements. Like I said, I've read more than 50. I don't know exactly how many I've read. I've got an Excel spreadsheet, so I can count them up and let you know if you're really interested. But a lot of my students have been invited back for interviews, so I'm really proud of them and their amazing work. But in terms of work experience, those are what I would recommend, because they're easily accessible. Anything more you can get, such as GP or hospital care, it's amazing, but it is really difficult to get into. So I think I'm going to do one more question, because it seems as though we're halfway there and it's sort of already been almost 18 minutes of me talking. So if I had an offer from University for Medicine, would I take it? Short answer is no. And I think I've kind of covered that. I'm not really interested in the long-winded process of becoming a consultant. And I personally think, for my way of life and my goal in life, I'm really satisfied with, like, I've got a huge job satisfaction right now, and I really enjoy being a PA. I think it's great. I can do what I want in terms of where I can work. I don't have to bog myself down with one speciality. In the next few years, if I change my mind and I want to come out of GP and work in hospital, I can do that. I don't have to do any further exams or training. And I can work in different specialities and be trained in those specialities and kind of add it to my skill set. So if I want to go and work in A&E or surgery, I can go and do that and learn more things and be trained, more vigorously. And then I can go back into GP and use that knowledge that I gained. Whereas for doctors, they have to choose a speciality, and if they want to work somewhere else, they have to do further exams and also further training in order to work in that field, whereas it's not the same for us. So it's almost 20 minutes that I've been videoing now, so I'm going to take a break, and I actually have a conference call now with a student who wants some interview preparation, so I need to get myself ready for that. But thank you for listening. I hope this was helpful. Please subscribe to my YouTube channel, and every time I say it, I don't think it's going to get any easier, but I have to. Yeah, so I'll do the rest. Let me count. There's 1, 2, 3, 4, 5, 6, 7, 8, 9. There's about 10 questions left. So if you guys have any more questions, comment them on my YouTube channel, ask me them on Instagram, follow me on Instagram. I will be sharing and uploading a lot more videos similar to this. I'm trying to gauge with people who are not in the PA program yet and people who are studying as well. So if you think that this is helpful, let me know. And any ideas that you have for any future videos, also again, let me know. Thank you, and I hope you guys have a lovely day.